Hofstra's program was unique in a few ways, and I had looked at a lot of other programs, but Hofstra's program was much smaller than many of the programs I looked at, and also was much more selective. And having met with a few faculty members before deciding to accept the admission offer, I really got the sense that the intimate nature of the faculty in the department was going to be really important to getting me hands-on training and support needed to actually use the degree and be able to obtain employment with it. After completing, I'd say about a year and a half of the graduate coursework, the final step in the program is completing an internship, and my internship was actually 900 hours or 1 year long at the Zucker Hillside Hospital, which is the Behavioral Health Division of North Shore LIJ. That position was on an inpatient adult psychiatric unit, working with adults who have severe mental illness in an inpatient setting. And I was in that position for about a year, performing group therapy, working regularly with the psychiatric rehabilitation department to perform intakes and discharge plans, and really putting my clinical skills to use. So the coursework at Hofstra, in combination with my internship training, really provided a very comprehensive background for me to be able to get a job in mental health counseling and in the field. Specifically the coursework in group therapy and advanced group therapy taught by Dr. Weber. Dr. Johnson's foundation counseling skill courses were really fantastic, and something that was instrumental in feeling confident to go out in the real world and even intern was the use of the really hands-on clinical training that I received in many of the courses, including having counseling sessions videotaped and critiqued, being watched by my peers through a two-way mirror as I conduct a live session. These were absolutely instrumental teaching techniques that were essential to my success and my confidence as a counselor starting out. So since graduating, I received a job offer from Zucker Hillside where I was interning, and that position started off on the inpatient unit where I was initially interning. And a few months after that, an opportunity arose to move to the outpatient department, working in a supported employment counseling setting with adults who have severe mental illness who are trying to transition back to work. And after doing that for about a year, I had an opportunity to join a really exciting innovation program that's in the adult outpatient clinic at Zucker Hillside, using essentially health technology and intensive therapy treatment to help adults with schizophrenia and schizoaffective disorder to stay out of the hospital. And that's what I'm working on now with them. So in the process of working in a medical setting for about 2 years after graduation, all of that experience built up to qualify for me to apply that towards my licensure with New York State as a licensed mental health counselor. Once licensed, I was really interested in starting to gain some experience in the private practice setting. And having worked from a friend of a friend and heard of an opening, I was able to get started with someone else's practice, helping really children, adolescents, adults, people going through divorces, stressors, kind of everyday living concerns that people seek help for. And that's been incredibly fulfilling. And from that, I've really gained a lot of confidence to start my own practice, and that's Long Island Mental Health and Wellness Counseling. That's newly launched, and we're really excited to work with adolescents, especially in the context of anxiety and social media, as well as parents going through the transition of parenthood for the first time, and helping young people trying to navigate the world of work.